Welcome to Professional Certifications channel. In today's video, we'll explore a complete step-by-step guide for foreign nationals seeking medical treatment in India, from choosing the right hospital to getting your visa, traveling, and receiving care smoothly. India has become one of the top destinations for medical tourism, offering world-class healthcare, advanced technology, and affordable treatment. Let's begin.
Why India for medical treatment? India is recognized globally for its high-quality healthcare services at competitive prices. Here's why patients from across the world choose India. Availability of internationally accredited hospitals like JCI and NABH. Highly skilled doctors and specialists trained in Western countries. Advanced medical technologies and minimally invasive procedures.
Affordable cost, up to 70% lower compared to Western nations.
English-speaking medical staff and well-established medical tourism facilitators.
2. Step 1. Selecting the right hospital and doctor. Start by researching hospitals in India that specialize in your medical condition. You can visit websites of top hospitals such as Apollo Hospitals, Fortis Healthcare, Medanta, AIMS, or Narayana Health. Check the following before deciding. Specialization and doctor credentials. International Patient Services Department. Treatment cost estimates. Availability of teleconsultation before travel. Many hospitals offer online second opinions and help arrange your travel plan once treatment is confirmed.
3. Step 2. Applying for a medical visa. Foreign nationals coming to India for medical purposes must apply for a medical visa, M-Visa. Here's how you can do it. 1. Visit the Indian e-visa portal, https://indianvisaonline.gov.in. This link is given in the video description box. 2. Choose Medical Visa option. 3. Upload your medical invitation letter from the Indian hospital. 4. Provide your passport, photo, and medical documents. 5. Pay the visa fee and wait for approval, usually 3 to 5 business days. You can also apply for a medical attendant visa, MX visa, for up to 2 people accompanying the patient, usually family members.
4. Step 3. Preparing for travel. Once your visa is approved, plan your travel carefully. Confirm hospital admission dates. Keep all medical records, prescriptions, and test results handy. Book your flight and accommodation. Many hospitals offer nearby guest houses or patient accommodations. Arrange airport pickup and hospital transfer. Hospitals often provide this service through their International Patient Care Department. Don't forget travel insurance and foreign exchange for medical expenses.
5. Step 4. Arrival and hospital admission. Upon arrival in India, the hospital's international desk will assist you with registration. You'll meet your treating physician, discuss your case, and sign consent forms. Diagnostic tests will be performed before treatment or surgery. During your stay, interpreters, dietitians, and nurses will ensure your comfort. The hospital will also assist with visa extension if your treatment requires longer stay.
6. Step 5. Payment and cost transparency. Most hospitals provide clear cost estimates before admission. Payments can be made via bank transfer before arrival, credit card, or cash as per government limits. Always request a detailed cost breakdown, including consultation, procedure, room charges, and medications.
7. Step 6. recovery, follow-up, and return. After your treatment, doctors will guide you on post-operative care and recovery. You'll receive discharge summary, prescriptions, and medical records for your home doctor. Some hospitals also offer online follow-up consultations to monitor your recovery after you return to your country.
8. Bonus tip. Use medical tourism facilitators. If you prefer professional help, contact medical tourism agencies like Indian Health Tourism, IHT, Vaidam Health, Medmonks, IndiCure Health. They assist with hospital selection, visa, travel, accommodation, and post-treatment care.
9. Ethical and cultural etiquette. When in India, remember to respect local customs and hospital policies. Maintain patient confidentiality and cultural sensitivity. Follow doctor's instructions strictly for successful recovery.
So, that's the complete process for foreign nationals seeking treatment in India, from planning to post-recovery. India continues to welcome patients from around the world with compassion, care, and cutting-edge medical expertise. If you found this video helpful, don't forget to like, share, and subscribe to Professional Certifications channel for more tutorials on healthcare IT, quality, and global health systems. See you in the next video.